Welcome back guys. Now in this video let's discuss about flow volume loops. Okay, we are going to draw a graph between flow of air and volume, flow volume loops. Now in this graph you can see here is the inspiratory curve. Okay, on downside I am representing the inspiratory path and here there is this expiratory curve. Okay, downside it is the inspiratory curve, on top I am showing you the expiratory curve. Now let's start something like this. Now when I start to have inspiration, okay, I am taking inspiration very fastly. Now from where inspiration starts, already inside my lungs residual volume is there. So inspiration is not going to start from 0 ml, no. Already inside the lungs some volume of air is present. How much? Almost 1200 ml of air is present inside the lungs. So this 1200 ml of air which is all the time present inside the lungs is called as a residual volume. So inspiration is starting from somewhere around 1200 ml, not from 0. Okay, so now here we have started the inspiration. Now I am taking the air very fastly like this. So see, now air is going with fast, okay, and I can take almost how much air? 6 liters of air. So I can achieve total lung capacity that is somewhere around 6 liters. Okay, so this is the maximum flow of air. Okay, this is the maximum point. So I am taking the inspiration almost up to 6 liters, that is a total lung capacity. Okay, I am starting where? At residual volume. Okay sir. Now let's talk about expiration now. Now from here I have started the expiration. Something like this, very fastly. So air is going out, okay, air is going out. So the topmost point is the peak expiratory flow rate. Okay, so it is peak expiratory flow rate. How much? 8 liters per second almost. Okay, this much amount of air will start to go out. Okay, the maximum with that fast. Okay, and starting from here I am starting expiration and again I am coming back to normal residual volume. Okay, so inspiratory curve and expiratory curve, this is something which is seen in a normal person. Now if you understand this, let's talk about diseases where this flow volume loops are affected. Now first let's talk about obstructive lung disease and restrictive lung disease. What is the problem with the obstructive lung disease? The example of obstructive lung disease, OLD, obstructive lung disease here I am taking is a emphysema. In emphysema, what is the main problem, sir? There is loss of elastic recoil, elastic fibers are damaged. Okay, alpha-1 emphysema is due to alpha-1 antitrypsin deficiency. Whenever the alpha-1 antitrypsin deficiency is there, now what happens? There is damage to the elastic fibers. The elastic fibers are damaged means the elastic recoil of the lung is not happening. Whenever there is no elastic recoil, now there is problem with the expiration. There is problem with the expiration. So the person cannot be able to take the air out of the lungs. So air is getting trapped inside his lungs. So air trapping is seen in obstructive lung diseases. Okay, so the main problem is loss of elastic recoil. When the elastic recoil is not there means then the problem is with the expiration, so that causes air trapping. Extra air is now present inside his lungs, that makes his lungs more voluminous. His lungs are going to be more filled with the air. So if you look at an emphysematous person, if you look at his chest will look like a barrel. So barrel shaped chest is seen in emphysema. Okay, barrel shaped chest. Now why there is barrel shaped chest? Because of the air trapping. And whenever you do the percussion on these lungs, there will be hyper resonance. Okay, so there will be hyper resonance. He is not able to take the air out of his lungs. Now if you want to take the air out of his lungs, you have to use the extra effort. Okay, you have to breathe out the air something like this. With effort he have to take the air out. So he will be having pursed lip breathing. He is going to puff out the air by having a pursed lips. Okay, so these persons are called as pink puffers. Okay, emphysema patients are called as pink puffers. Okay, now the main problem is to take the air out of the lung. Air is getting trapped inside the lung. Okay, now if I say air is getting trapped inside the lung, extra air is there, right? So what happened to residual volume? Residual volume increases. What happened to total lung capacity? Total lung capacity also increases. Why? Because air is getting trapped inside the lung, so lung volumes will increase. Okay. Now let's talk about the restrictive lung disease. The example of restrictive lung disease is pulmonary fibrosis. Now the lung is getting fibrotic, alveoli are getting fibrotic. If the alveoli are getting fibrotic means now you cannot easily stretch them. So the compliance nature of the alveoli are going to be decreased. When the alveoli are non-compliant means you are not able to expand them. If you are not able to expand them, the problem is with the inspiration. Air is not entering into the lungs. You can't get the air into the lungs. Okay, so restrictive lung disease, the pulmonary fibrosis example, the main problem is non-compliant alveoli, fibrotic alveoli. The lung is getting fibrotic, the lung is getting smaller in size. Okay, it's getting shrunken down because of the fibrosis. So decreased filling in the alveoli, so inspiration is the main problem. So in this slide, what we have discussed is just like a basics, like the basic pathology. In obstructive lung diseases, the problem is with the expiration, and in the restrictive lung diseases, the main problem is with the inspiration. Having said that, now please look at the flow volume loops, how the flow volume loops are affected in obstructive lung disease and restrictive lung disease. Let's keep it as simple as possible. Okay, just by looking at the graph, you should be able to identify whether the graph is talking about the obstructive lung disease or is it a restrictive lung disease. See, in obstructive lung disease, what's the main problem? In obstructive lung diseases, the patient cannot be able to take the air out. Okay, air trapping is happening. Now when air trapping is happening, see, the extra air is going to be present inside the lungs. So that increases the residual volume. So instead of inspiration getting started at 1.2 liters, now inspiration is getting started at 2.5 liters. So residual volume increases. Also we have discussed air trapping, voluminous lungs, total lung capacity increases. So he is going to start his inspiration from here and see his inspiration is coming to this area, that is total lung capacity, almost 6 liters of air is getting into his lungs. So now the curve is moving towards left. Okay, there is left side deviation of the flow volume loop. Okay, now remember, see, the flow is decreasing automatically. Okay, in the previous condition, if you look here, see, the flow of air is almost till here, 4 liters. But here please concentrate, now the flow is coming down. Okay, now, okay, the inspiration is slightly reduced, not that much, slightly reduced. Okay, slightly, okay, little reduced. Now, please look at the expiratory path. Now, even the expiratory path, the peak expiratory flow rate, even the peak expiratory flow rate is also decreased. Now, previously, he can able to take the air out of his lungs very fastly. Okay, he can able to take the air out of his lungs, almost 8 liters per second. Okay, please concentrate here. So with this much speed he can take the air out of his lungs. Now in obstructive lung disease, the main problem is with the expiration. So now PEFR, peak expiratory flow rate, is now coming down from 8 to 6, not even 6, 5.5. So peak expiratory flow rate is decreased. Okay, now this is about the obstructive lung disease. Now let's talk about the restrictive lung disease, guys. We know in restrictive lung diseases, what is the main problem? The main problem is he cannot get the air in, fibrotic alveoli, small lungs. Okay, now when the lungs are getting smaller, automatically residual volume decreases, total lung capacity decreases, all the volumes and capacities, they will come down. Okay, now in restrictive lung diseases, the patient is not able to get the air into his lungs, fibrotic alveoli, small lungs. So what is happening to the residual volume? See, residual volume is now getting smaller. I should say here should be the one small mistake. Now instead of starting at 1.2 liters, now inspiration is starting from 0.8 liters, 800 ml. So residual volume is decreased in restrictive lung diseases. Also the total lung capacity. See, this is the maximum total lung capacity that he can get. Okay. So residual volume decreases, even total lung capacity decreases. Now what is happening? The shift is happening towards the right side shift. Okay, here there is left side shift. So how to identify obstructive lung disease and restrictive lung disease based on the flow volume loops? In obstructive lung diseases, the flow volume loop is going to shift to the left, and in restrictive lung diseases, the flow volume loops are going to shift to the right. And one more important characteristic feature which just by looking at it you can identify is, sir, in obstructive lung diseases, OLDs, there is a coving of the expiratory curve, just like a cove. Okay, now whenever you take a small scoop from the ice cream, okay, like that, there is a coving, this bending is seen. Okay, so 𝐜𝐽ing is seen in obstructive lung diseases. There is no such 𝐜𝐽ing in restrictive lung diseases. So 𝐜𝐽ing pattern, 𝐜𝐽ing of the expiratory curve, this 𝐜𝐽ing is seen in obstructive lung disease. Okay, in restrictive lung diseases, see, all the volumes and capacities are decreases. So residual volume decreases, total lung capacity decreases. Okay. Now, even restrictive lung disease, see, the inspiratory flow is decreased as well as expiratory flow. Inspiratory flow, expiratory flow, both are decreased. Okay. Now, after understanding this, let's understand the concept of what is forced vital capacity, what is FEV1. Okay. Now, let's see how they are going to be changed in obstructive lung diseases and how they will be affected in the restrictive lung diseases. Now, in order to understand that, first look at this graph. Now, here I am showing you the time on the x-axis. Okay, on x-axis I am showing you the time. On y-axis I am showing the volume. Okay, I am showing you the volume. Now, the patient, I am asking a normal healthy person to expire the air out of his lungs. Now, he is forcefully expiring the air out of his lungs. So, how much air he can take out of his lungs? See, now he is taking the air out of his lungs. For almost 6-7 seconds, he can take the air out of his lungs. The maximum air that he can take out of his lungs is the forced vital capacity, this green color thing. Forced vital capacity is the maximum amount of air that he can take out of his lungs. Okay, almost 5 liters he can take out of his lungs. Okay, forced vital capacity. Okay, with the force, he is taking the air out of his lungs, maximum expiration possible. Total lung capacity is 6 liters. But maximum, how much he can take out? He can take out almost 5 liters. Okay. Now let's write it down here, guys. Now the maximum, how much he can take out is 5 liters. Okay, that's 5 liters. Okay. In 5-6 seconds, he can take it out. But what is FEV1, sir? What is FEV1? See, in 5 seconds or in 6 seconds, he can take out the entire, entire air out of his lungs. That's a forced vital capacity. That's 5 liters. But remember, in a healthy person, in the first minute itself, sorry, not in the first minute, the first second itself, he can take out almost 80% of the forced vital capacity. The 80% of the forced vital capacity is going to come out in the first second itself. This is called as forced expiratory volume in first second, FEV1. Sir, what is FEV1? In the first second, see, in the first second itself, 1 second, this is first second, this is second second, here third, here 4, here 5. Let's take. In 5 seconds, he can take out 5 liters. Okay. But in the first second itself, how much he can take out? See. He can take out almost 4 liters. So 5 by 4, or like I should say, FEV1 by FVC. Out of FVC, out of 5 liters, he is taking out 4 liters in the first second itself. So, what is the normal FEV1 by FVC ratio? Normal FEV1 by FVC ratio is 0.8, or I can say 80% of the air will come out of the lungs in the first second itself. Okay, that's a FEV1 by FVC ratio. Now, let's discuss how this FEV1 by FVC ratio is going to be affected. Okay, in obstructive lung diseases and restrictive lung diseases. Now, first let's talk about the obstructive lung diseases. In obstructive lung disease, what is the main problem? The main problem is the person cannot be able to take the air out of his lungs. Okay, it's very difficult for him to take the air out of his lungs, emphysema patient. But remember, with effort, with the pursed lip breathing, at the end of the day, he can take the air out. Okay, it's normally, he cannot take it out, but with effort, he can take it out. Okay. Something like this. With effort, he can take the air out of his lungs. So, now, please look at the graph. See, blue color graph, I am showing you the blue color graph. Now, this blue color graph is the forced vital capacity in a patient who is having obstructive lung disease. Please appreciate, even the obstructive lung disease patient, he can almost match the forced vital capacity of a normal person. Even this fellow also, obstructive lung disease patient, he can also take the air out of his lungs. But where comes the difference? The difference is with the FEV1. Okay, he can take 5 liters of air out of his lungs. Okay, he can take out almost 5 liters of air. Almost. But where comes the difference, sir? A normal healthy person can take 80% of the air out of his lungs in the first second itself. But please look at here. In obstructive lung disease, what is happening? So in the first second, please look at the blue color graph. In the blue color graph, please concentrate. In the first second, is he able to take out 80% of the air out of 5? Is he able to take 4 liters of air out of his lungs? No. He can only take maybe 3 liters of air. So what happened to FEV1 by FVC ratio? Automatically decreases. Automatically decreases. It's not 80% now. It may be 60% or 50%. Okay. So let's see one by one. In obstructive lung disease, okay, forced vital capacity and FEV1 are reduced. Okay, guys, just it's not obstructive lung disease, it's the restrictive lung disease. Please make a correction, restrictive lung disease. We'll get back to this later. We'll get back to this later. But first, see, in a normal lung, okay, in a normal lung, what is happening? FEV1 by FVC ratio is how much? 0.8. We have discussed. What happens in an obstructive lung disease? In obstructive lung disease, FEV1 by FVC ratio is going to decrease. Okay, it's not 0.8 now, it's just 0.5 or 0.6. Why? Why? Because FVC is normal, but FEV1 will be decreased. Okay, FVC, this area. Okay, FVC is normal, but FEV1 in the first second, okay, 80% of the air is not coming out. Only 3 liters is coming out, or even 2.5 liters is coming out. So FEV1 by FVC ratio decreases. Now let's talk about the restrictive lung disease, guys. Okay, now let's discuss about restrictive lung diseases. Please concentrate on this orange color curve. Okay, orange color curve. Now you can clearly see. Now the lungs are fibrotic. Restrictive lung diseases. Lungs are fibrotic. Small lungs. All volumes and all capacities are decreased. Now he cannot take enough air into his lungs, and he cannot take enough air out of his lungs. Why? Because small lungs. All volumes are decreased. Okay, now what will be his forced vital capacity? Please look at this. The forced vital capacity is now not 5 liters. Now what happens? It's now just only 3.5 liters or 4 liters. Okay, so forced vital capacity is now getting decreased. Now let's see. This is the point. Maximum he can take out. Now if you see, means he can take out almost just only 3.5 liters. Okay, 3.5 liters is the maximum that he can take out. But a normal person can take out 5 liters. My forced vital capacity is 5 liters. The patient who is suffering with restrictive lung disease is having a forced vital capacity of 3.5 liters only. So FVC is decreased, no doubt. FVC is decreased. Not only FVC, please see here the FEV1 of orange graph, please concentrate. FEV1 is also decreased. Now FEV1 in a normal person, okay, FEV1 in a normal person is 4 liters. Now here it is 3 liters. Okay, so what I am trying to put into your mind is, sir, FVC decreases, no doubt, but FEV1 also decreases proportionately. So as both of them are decreasing in a same proportion, what happened to FEV1 by FVC ratio? FEV1 by FVC ratio is normal. Okay, sometimes it will be increased, but most of the time it is normal. Okay, why? Because both of them. See, in restrictive lung diseases, FVC decreases as well as FEV1. Both are reduced, but proportionately. So FEV1 by FVC ratio is normal. Okay, so now let's see what are the differences between obstructive lung disease and restrictive lung diseases. So in obstructive lung diseases, we have discussed FEV1 by FVC ratio is reduced. What is the normal? 80% is normal. Okay, up to 80%. See, 70 to 80% is a normal range. Okay, but if you look at the obstructive lung diseases, the FEV1 by FVC ratio is going to be reduced and it will be less than 70%. Okay, and restrictive lung diseases, FEV1 by FVC ratio is normal. Okay, normal. Please just make a correction. It is normal. Okay, it will be somewhere around 70 to 80%. Okay. Now, what happened to FEV1? What happened to FEV1 in obstructive lung disease? So, in obstructive lung diseases, FVC is normal. Okay, most of the time FVC is normal or slightly reduced. FVC is normal, but what happened to FEV1? FEV1 is reduced. See, FEV1 is reduced. FEV1 is reduced. Okay. Now, what happened to the FVC? FVC is normal. FVC is normal, but FEV1 is reduced. And at the end of the day, in obstructive lung diseases, air trapping is happening. What happened to total lung capacity? Total lung capacity is increased, sir. Or normal or increased? And what happened to residual volume? Extra air is getting trapped inside his lungs. So it is increased. Now let's talk about the restrictive side. Sir, in restrictive lung diseases, what's happening? FEV1 by FVC ratio is normal because both of them are decreasing proportionately. What happened to FEV1? Yes, reduced. Okay, most of the time it is reduced. Okay, most of the time it is reduced. What happened to FVC? FVC is also reduced, sir. Okay, FVC is also reduced. And this fibrotic lungs, restrictive lung disease, the lungs are fibrotic, so small lungs. So what happened to the total lung capacity? Total lung capacity is reduced. And what happened to the residual volume? Residual volume also decreases. Okay, so these are the changes which you will see in obstructive lung diseases and restrictive lung diseases. Having discussed that, now look at the flow volume loops in the three diseases: obstructive disease, normal and restrictive lung disease. Obstructive lung disease, I have already explained to you. See, this dotted line is the normal. Dotted line is the normal one. Okay, normal flow volume loop. Normal flow volume loop. Okay, but what is happening in obstructive lung disease? In obstructive lung disease, see, now the curve is moving towards left side. Okay, there is coving of the expiratory curve. Peak expiratory flow rate is decreased, and even the inspiration also decreases. Again, inspiration is not that affected, but peak expiratory flow rate is affected. It should be 8 liters, but it's now coming down. See, okay, this is obstructive lung disease. Loop shift to left. There is more residual volume. See, there is more residual volume. Even total lung capacity increases. In this condition, now the total lung capacity is almost 8.5 liters. Okay, it should be 6. Now it is 8.5 liters. Okay, now this is something normal. See, obstructive lung disease. Now, this is a normal curve which is starting at a residual volume of 1.2 liters and achieving a total lung capacity of 6 liters. This is something normal. Okay, this is a normal curve. In restrictive lung diseases, see what is happening. So in restrictive lung diseases, the loop shift to right. Okay, residual volume decreases, and even the total lung capacity decreases. The entire graph becomes smaller. Okay, smaller lungs, smaller volume, smaller capacities. Okay, now after this, please look at this flow volume loop. Now this flow volume loop, this type of flow volume loop is seen in conditions wherever there is fixed upper airway obstruction, like tracheal stenosis. Whenever there is a stenosis in the trachea, or whenever there is a tumor, or whenever there is goiter which is compressing the upper airways, what will happen? The amount of air that will enter into the lung decreases, automatically the amount of air that will exit out of the lung decreases. Okay, now air is going slowly inside and slowly outside. So you are going to have a flattening of both the inspiratory and expiratory limbs. Both inspiratory limb, expiratory limb, both are decreased slowly. Okay, now air is going slowly. There is no problem with the lungs. No problem with the lungs. Air will go. Okay, starting from the residual volume. Okay, now air is going slowly and achieves the total lung capacity. And air will come slowly out of his lungs. Okay, so peak expiratory flow rate is decreased, and peak inspiratory flow also decreases. Expiratory flow, inspiratory flow, both are decreased. So flattening of both the inspiratory and expiratory curves is seen. Okay, now let's see here all the graphs in one single thing. Now here, please look at, guys, the black one which I am showing you, the black curve which is normal. Okay, starting from here. Okay, starting from here, this is 1 actually. Okay, starting from residual volume 1.2 liters, achieving a maximum total lung capacity of 6 liters. Okay, if black is normal, see what is this green curve? The green curve is having coving pattern, coving of the expiratory limb, and even the green curve is shifting towards the left. So left shift is seen in obstructive lung diseases. So green is obstructive lung disease. This pink one, the blue one. See, this blue curve is shifting towards the right. Okay, the blue curve is shifting towards the right, and please look at here, the residual volume is decreased. Okay, the residual volume is decreased, and even the total lung capacity is decreased. Okay, so this is restrictive lung disease, and the small one, the small curve with the flattening of both inspiratory and expiratory limb. The small curve is the example of upper airway obstruction, fixed upper airway obstruction. So with this, we have discussed flow volume loops, how the flow volume loops are affected in different conditions like obstructive lung disease and restrictive lung disease. Hope the video is helpful. See you in the next video. Thank you.